South Africa is moving ahead with plans for universal healthcare. Legislation around the new national health insurance is before cabinet and is being finalized. Work around the scheme has been ongoing for years now and will still take a long time to be completely implemented. But the health ministry is keen to get the first phases of the system up and running. Sumitra Nydoo sat down with South Africa's health minister to find out how it will work.
Our system is based on the British model, the NHS, which was implemented in 1948. It's going to be a gradual thing in phases. And in 2010, when the ANC National General Council took a resolution that we must start implementing NHI from 2011, and it will take 14 years, we said it must be done in 3 phases. The first phase is a preparatory phase. It's just coming to an end this year. The next 5 years, which starts next year, is for setting up systems and structures and committees to run NHI.
What are we looking at in terms of the cost and how it's going to be funded?
We did not have the expertise to calculate how much it will cost, but we asked for the World Health Organization to help us. Nobody has introduced universal health coverage, because that's what United Nations calls it, has ever calculated how much it will cost, because it's not possible. There are many variables. What you calculate is the cost of a particular program or a particular benefit under NHI. When we start implementing NHI, we're going to choose 5 groups of vulnerable people and put up packages of what type of health care are we going to give to them. It is the 12 million school-going kids in terms of their physical barriers to learning, checking their eyesight and correcting it, their hearing and correcting it, their oral hygiene, their speech. Secondly, it's about pregnant women. There are 1.2 million women who fall pregnant every year. Can we make sure that each one has got a package to visit the doctor a minimum of 8 times during the pregnancy, 2 times of which they must be put under a sauna to see if the baby is normal or what. And then the whole, that's maternal health, but women's health issues in general, like family planning, contraception, breast cancer, which is the biggest killer of women, and cervical cancer. We need to solve that. The third group are the elderly people who need operations for cataract, knee replacement, hip replacement, and other assistive devices. The fourth group are mentally ill patients, which will bring to an end things like the Life is Dimeni saga, which you're all watching now. And then lastly, the disabled people. You know, they need assistive devices and many types of help. Those packages we can cost and fund and say this program to provide those packages will cost this much. And we've been able to budget for them because we know the precise figures. In the next 4 years, that program will need 69 billion rand.